Hi, it's Mimi Alliance. I'm a student here at the UCF College of Nursing. I'm presenting a SNAPPS video report to my preceptor, Dr. Kubier, on patient KB. This patient is 21 years old. They are a white, non-Hispanic, genderqueer, bisexual patient. This patient is G0P0, here for a gynecological preventative exam, pap smear. The patient also wants to extend the Daysee extended cycle contraception that they're on, and they are looking to renew that prescription. This is the patient's first pap smear, and during evaluation, the patient screamed out of a sharp vaginal pain. I also, as I was inserting the speculum, observed a gray malodorous discharge, and this could be possible atrophy. The patient has a past medical history of PCOS, which is managed with metformin 200 milligrams PO daily. They also have an unspecified mood disorder. They deny smoking, alcohol, or drug use. Narrowing down the differential, I suspect BV, as I observed that gray malodorous discharge and witnessed the clue cells on microscope. So first-line therapy is indicated. The atrophy I was suspecting, but considering her age and also that she has hormones from her contraception of estrogen and progesterone, I'm not leaning towards that. The other suspicion I have is a possible STI. I'm considering chlamydia, gonorrhea, trichomonas, and also I'm considering infection irritation. The acute inflammation explains the speculum pain. The other consideration I went over in my mind had to do with pelvic floor spasm anxiety. The exam was aborted, and I suspect that she could possibly have some anxiety as this is her first pap smear. Dr. Kubier, would you obtain an NAAT for the chlamydia, gonorrhea, trichomonas suspicion before initiating the BV treatment? Should we confirm BV with vaginal pH or whiff test prior to therapy? For future exams, should I consider pre-treatment with topical lidocaine or low-dose hydrocortisone so that I can help with the tolerance for this patient? After inflammation resolves, when would you schedule her routine pap smear? How much time would you give? The plan I have today is to treat the BV with Flagyl, 500 milligrams PO BID times 7 days. I will renew the patient's Daysee prescription and counsel on adherence. I'm going to ask the patient to follow up in 2 weeks to evaluate treatment response and to reschedule that pap smear. I'm also going to advise the patient that if she notices any white discharge, itchiness, redness, that she call in because she may develop a yeast infection, as the Flagyl can alter the vaginal flora. I will prescribe her a medication at that time, possibly gyne-lotrimin, 1 applicator at bedtime if that develops. I will review guidelines on managing speculum intolerance and acute cervical inflammation. Thank you, Dr. Kubier, and I welcome your guidance on STI screening, BV confirmation. Thank you.